Welcome to the major assignment, powerlifting, done by myself, Matt Wilson, Zack Reyes, Antonio Rodriguez, and Malcolm Gray. For my portion of the assignment, I handled the physical and physiological demands of powerlifting, which is going to revolve mainly around the squat, the bench, the deadlift, the main three movements. Range of motion is demanded between upper body and lower body. Flexibility at the shoulder to grab the bar behind the neck and the head. Flexion and extension at the hip, knee, and the ankle so that you can return from the bottom position upright. And then the main prime movers done by EMG are going to be the back and hip extensors, the psoas, iliacus, glute max, adductor major or magnus, and then adductors such as the glute med to stabilize the femoral head, as well as the quadriceps, the vastus medialis, intermedius, lateralis, the rectus femoris, and then ankle plantar flexor muscles like the gastrocnemius and tibialis anterior. For the next exercise, it's going to be the bench. And for the bench, we focus on the main 5 points of contact. It's going to be your feet on the ground. It's going to be your butt on the bench, your shoulders on the bench as well, scapulas retracted down and back, using those rhomboids in the mid and lower trap. And then head on the pad, and then hands on the bar. You're going to unrack the bar. You're going to proceed to pull the bar down to your chest, press it back to the original location, and then rack it for a complete lift. This recruits a pec major, the triceps brachii, as well as the anterior delts. For the next one, the deadlift, the king of the lifts. It's going to be a loaded barbell in front of an athlete. You're going to lift the weight off the ground until you're fully erect with your hips and knees locked in place. The prime movers, despite the whole body being engaged, the prime movers for the upper body are going to be the upper mid traps, rhomboids, and erector spinae. And for the lower body, it's going to be the glute max, the hamstrings, the semimembranosus, tendinosus, biceps femoris, as well as the adductor magnus. Those are the physical and physiological demands.
All right, now we're going to move on to the mechanisms of injury. Working with a strength athlete, most people assume that a catastrophic injury is going to be the main injury, such as a blown out knee, a herniated disc in your spine, or so on and so forth, even a broken bone. It's actually not the case. It does happen, but the prevalence of them are not as high as most people think. Go back a slide. The main mechanism of injury is actually repetitive motion injury that causes inflammation in the soft tissue. And that's going to prevent athletes from being able to maintain training due to the pain. Something else to take into consideration is your individual athlete. Age will play a factor in what part of the body gets injured. So an older athlete, for instance, in the master's class, which is 40 years old and older, they're going to suffer more from shoulder injuries, either from the benching motion or the external rotation of trying to hold the bar on their back during a squat. So something you're going to want to take into consideration when you're training an older athlete. You're going to want to maintain the strength of the shoulder and also the mobility of the shoulder to help prevent injury, or at least the occurrence of it. Gender also plays a role. It was found that female athletes have a higher occurrence of wrist injury and elbow injury compared to men. So most likely due to the bench press, the increased load on the wrist. There's a couple ways that we can address this. You can either wear a wrist wrap to help support the wrist. You're also going to want to increase the forearm strength to increase wrist stability and strength. It was also found that warming up doesn't affect the occurrence of injury. If you're going to get injured, you're going to get injured. But what warming up will do is it'll help facilitate performance. It was found that a warmer muscle can contract faster and produce more force and strength than a cool muscle. So when it comes to a 1 rep max or very high intense movements, the warm up is going to be crucial just for performance sake. Next slide. Something that did seem to reduce the occurrence of injury was going to the sauna and regular swimming. What the sauna does is it helps promote blood flow, especially to the skin, and help reduce the inflammation. And at the end of the day, when you're doing high repetitive motions, you're going to want to reduce that inflammation after a workout to help with recovery. Swimming also, the light impact motion of swimming, moving the joints through the range of motion also help reduce the occurrence of injury. In regards to lifting equipment, there's some conflicting views on this one. I had mentioned previously the wraps helping to support the wrist and not prevent, but reduce the occurrence of injury. There are also lifting shirts, which are very, very tight shirts that help compress everything. Those have been shown to reduce shoulder injury. The only problem is they're incredibly expensive, and it takes an army of people to get them on because of how tight they are. The biggest one that a lot of people don't understand is the belt. It was actually shown that using a lifting belt, there is a higher occurrence of lumbar spine injury. This is most likely due to the confidence of having a belt and not relying on the athlete's ability to stabilize the core. So they'd load the bar with too much weight that their body could not handle, which would cause a back injury. So these are a lot of things to take into consideration when it comes to, equipment, gender, age, so on and so forth. Good.
All right, so for our testing protocol, we're gonna have 2 tests. It's gonna be the 1 repetition maximum, specifically the bench press, but it goes over quite a few things. And then we're gonna have the back squat mobility test. So the reasoning behind this is because bench press and back squat are gonna be 2 of the 3 lifts that are used to compete in powerlifting. And obviously you wanna go with those because if you can't compete in powerlifting, then what's the point of doing it? Cool, so for the 1 repetition maximum test, from COD et al., they conducted a research study on the reliability of the 1 repetition maximum test based on muscle group and gender. So in there was things like lat pull downs. They actually had the squat in there and bench press, but we're just going to focus on the bench press. The participants for this exercise were 30 healthy males and females who have experienced at least 3 months of continuous resistance training during the last 2 years. They were anywhere from age 18 to 35. So pretty much how it went is they took the repetition maximum. It was taken 2 times, and it was over the span of 4 visits. So each time they would max out on one exercise, they would wait 48 hours, and then they would have them come back and test the other exercise, and they'll wait another 48 hours, and then have them come back and test the same one. So normally what you'd want to do as far as if you're testing someone that's not familiar with the workout they're going to get tested on for the maximum is you're going to want to have them do a familiarization process. This is just to avoid any improvements in the repetition maximum from motor coordination or other neurological adaptations that just occur when you go from being a novice that has no experience to a beginner that has some. So that's going to be pulled from Kramer et al. From 2006. So we're actually going to go ahead and have them warm up with dynamic stretching instead of static. The sole reason is going to be because it's shown that dynamic actually has less of an effect on the torque production than static stretching. And then so what you want to do is you want to give a lot of attention to the stability conditions and the velocity of the movement because it can negatively affect the bench press. Just depending on what's happening. If you have stability issues, it's going to probably highlight some bigger issues like muscle imbalances or just that like some muscles aren't up to par with things like the pectoralis major and what it can put up. An example, the velocity is going to be like when you're doing the movement, if you come down really slowly and then try to go back up really slowly, you're actually going to be engaging a lot of your type 1 fibers versus your type 2, so you're not going to be able to put up as much weight as normal. If you've ever heard of it, it's like the bouncing on the chest. It's not really a bounce, it's just you reacting as fast as possible so that way you recruit more of your type 2 fibers instead of your type 1s. So for the back squat mobility test, this is going to be more of just to test the kinematics of it instead of the power. We're not trying to max out on this one. So it's a really important test because you want to avoid future injuries in your elbow and your shoulder girdle. If, as Malcolm said earlier, a lot of the issues that are going to happen when you squat are going to be on your elbow and shoulder just because they have a lack of range of motion, and then you're forcing them into a range of motion that they're not used to, and you can cause a lot of injury, especially when you're at a competition or if you're going for like 80% intensity and using a lot of weight it's not used to. So as referenced earlier, the squat is going to be one of the primary movements for a power lifter, and the reason we really want to test specifically for the squat is just to make sure that the athlete is going to be able to go properly for the competition requirement for the depth, because if you don't hit the certain depth, then that squat doesn't count, and it can lead to a lot of issues, especially when you're competing. Again, this is just a good test to have because it is part of functional fitness for the sitting and lifting, just in general life. So as said previously, it is going to be used to assess the kinematics of the movement. It's really only going to require a lightweight cylindrical dowel over the shoulders. It's just going to be there for arm positioning, but it's super lightweight. We're not trying to see how much weight you can push out. So this test is going to highlight any biomechanical deficits, any muscle imbalances. It'll assess strength, not really power, just stability and the mobility of the movement. So they're going to go ahead and do the back squat for a total of 10 times. They're going to want to view this from the front anteriorly, from the back posteriorly, and from the, both sides laterally. So we're going to engage the Valsalva maneuver during this test. Given the person we're training, they should have experience with the Valsalva maneuver. But just to go over what it is, pretty much it's when you're going to go down the movement. You breathe in oxygen about 80% of your capacity. You tighten your core, and then when you go down, it just gives you a tighter core side where you're not bending over with the squat, and you're keeping it the tight core, keeping yourself upright to avoid any injuries. And that's it.
For our training program, week 1, we're going to be focusing mainly on form and technique of the athlete before we measure his strength. The reason we do this is because we don't want him jumping directly into a 1 RM and potentially risking injury. After correcting his form and ensuring that he has all the proper tools necessary, we will then measure his 1 RM. This will be his baseline for his program, so making sure that it's accurate is vital. Each week, the intensity of the program will slightly increase with volume decreasing. This solidifies the transition from technique into power. For weeks 2 through 4, our exercises will range from 60 to 70% of the 1 RM. We would also begin to incorporate HIIT workouts. Having HIIT workouts within this training cycle also shows the transition into power. It familiarizes them with quick, powerful movements followed by longer portions of rest. 60 to 70% is vital because it allows us to ensure a linear peak leading up into the 8th week. At the end of our 4th week, we will again measure his 1 RM. This will help us to measure progress and provide us with a baseline to judge how the next 4 weeks will go. Throughout, we will incorporate main and accessory movements. The purpose of accessory movements is to provide greater muscular stability throughout the body as a whole. Right and left side balance is vital in these movements because throughout the exercises, you need to ensure that all portions of your body are moving at an equal speed and that you have no instabilities in the muscles. In weeks 5 through 8, the accessory movements will decrease in intensity, so as we do not want to fatigue the muscles heavily and potentially risk injury during our main movements. The main movements, which are the bench press, the squat, and the deadlift, are all considered compound movements, which essentially means that they incorporate many muscles throughout the movement. In week 5 of our program, we want to move into 70% of 1 RM, and progressively through week 8, we will continue to raise the percentage by 10% up through week 8. In week 8, we will peak at 95% of our 1 RM, and at the end of week 8, we will then measure the 1 RM. In comparing weeks 1 through 4, weeks 4 through 8, we will be able to see how well our program worked for this athlete, and it'll also show whether or not they're going to be able to compete, and it shows their ability for growth as well as our ability to train them.
And the way we set up our program is to have, when your main lift for that day, whether it be squat, bench, or deadlift, for the main squat movement of that day, we'd accessorize with deadlift. That way, at least you're hitting the main movement twice a week, getting those reps in, getting familiar with the movement patterns, and familiarizing yourself with that. And then a lot of the accessories we focused on hitting imbalances that are probably there in the body, something that is not targeting specifically muscles doing our compound lifts, and then just making sure that symmetrically, we're very balanced for the athlete, making sure that we don't have any sides that are weaker than the other, so that we can target any power leaks that they may have. And that's kind of how we went about deciding our program. Anything else for you boys? Show off. Yep. I think I'm good. Do you want to cue the kilt or what?
All right. Yeah. All in all, that's our whole of the program. Given these movements and everything we know, this athlete should be ready, especially with their background. Other than that, we'll have a very successful training cycle. All right, everyone stand up and bow. Oh, yeah, you thought
Shorts all day, baby.
you got that extra breeze with the kilt. It's nice.
Not fair.
Shorts and kilts is how we're doing presentations from now on.